Hello everyone, welcome back to my channel. Today's topic is otosclerosis from ENT unit, Medical Surgical Nursing. Let's get started with the video. Otosclerosis refers to sclerosis of oto, that means ear. So, whenever there is problem in the amplification of sound inside the ear, this condition is called as otosclerosis. The three bones which are present in the inner ear, malleus, incus, and stapes, they vibrate in order to amplify the sound wave and take it to the internal part of the inner ear. So, if they are not able to vibrate properly, there is no amplification of the sound waves. They are characterized by symptoms like hearing loss, ringing sensation in the ear, or vertigo. This condition is also called as hardening of the ear. With hardening of the steps also become unable to move, immobile. That prevents transmission of sound as a vibration, leading to conductive hearing loss. This is a diagram pointing otosclerosis. This is the inner ear, the three bones of inner ear. This is cochlea, labyrinth, and this is tympanic membrane, middle ear. We have types of otosclerosis. They are histological and clinical. Histological otosclerosis does not have any specific sign and symptoms, but it can be detected during autopsy of a patient after death. Where clinical otosclerosis has sign and symptoms. It can be detected during life. They are divided into stapedial, cochlear, and mixed otosclerosis. Stapedial produces ankylosis of the membranous labyrinth. Cochlear produces sensory neural deafness, and mixed has both the features of ankylosis and sensory neural deafness. So these all can be detected through sign and symptoms of hearing related to hearing. The disease otosclerosis is genetic in nature because its cause is genetic. If there is a fault in the production of SERPINF1 gene, then the person might suffer from otosclerosis. Other factors can be exposure to loud noise for a long period of time, contributing to tinnitus. Exposure to sound greater than 100 decibel is generally not good for us. And if we get exposed to that sound for a long period of time, exposure to such a loud noise for a long time can contribute to tinnitus. Next etiology can be viral infection. If there is presence of viral infection in the ear, that can cause or actually contribute to this disease, contribute to otosclerosis. Other risk factors are gender. That is, women are more likely to develop otosclerosis than men. Family history can be next risk factor. Person having a positive family history is likely to suffer from this disease more than others who doesn't have family history. Next is pregnancy. Pregnant mothers also have generally more tendency than other people. Pathophysiology of this disease can be, first of all, genetic defect. Due to genetic defect, defect in SCR gene, there is hardening of bone in the inner ear, which can occur at any age. Comparing this to otitis media was more common in children, but otosclerosis can occur at any age. Because of this, there is disturbance in the vibration of bone. The bone used to vibrate to amplify the sound, and that vibration is disturbed now, which leads to conductive hearing loss. Features of this disease can be gradual hearing loss. Gradual, that means hearing loss gets worsened from time to time. Next symptom can be dizziness. This is the first CNS symptoms that can be seen in otosclerosis. Tinnitus, roaring. Patient can hear a roaring sound inside the ear, or patient can also hear buzzing sound inside the ear. There might be signs of vertigo, headache, and earache, otalgia. To diagnose this disease, there is the need of history and a physical examination, proper ear examination. We can perform tuning fork test that includes Weber's test and Rinne's test. We can find out ear conduction, bone conduction, and what is the normal ear and bone conduction condition of the patient. We can also do audiometry tests to find out the hearing ability of the patient. Tympanocentesis, that is drawing out the fluid which is not needed by the tympanic membrane out of the ear. That fluid can be provided for culture to find out nature of the pathogen. Also, MRI can provide a proper 360-degree image of the bone so that we can find out from which side the otosclerosis has started, how is the bone vibrating when it receives the sound, what is the abnormality inside the ear, and how it should be treated. The general management of this disease is, first of all, we should know about the symptoms. The symptoms of otosclerosis might get worse with time. So it develops over time. Medically, if we want to supplement, we can provide fluoride, calcium, and vitamin D. Also, because there is otalgia, presence of pain, analgesic can be used, ibuprofen and acetaminophen. Hearing aid can be used to treat hearing loss. Hearing aid is a device which artificially amplifies the sound that the bone inside the ear should have amplified. Use of hearing aid helps to amplify the sound and become able to hear. Avoidance of noisy environment should be done because this exposure to noisy environment continuously for a long period of time aggravates the otosclerosis. Surgically, there can be stapedectomy. In this procedure, we can drill a hole at the stapes and remove the affected part so that after the procedure, vibration can be occurred normally. Nursing management for this disease can be, first of all, assessing the correct sign and symptoms. After that, performing Weber's test and Rinne's test by using a tuning fork. While sleeping, patient should be advised to use a side lying position because using side lying position towards the affected side might provide comfort to the patient. But this disease can occur in the both ears because the cause is genetic, and this if this disease has occurred in both the ears, then the side which is more affected, a patient can use that side as a sleeping position. More affected side, right or left, lateral. Sign of nerve damage should be assessed. Sign of nerve damage can be immediate hearing loss or sudden hearing loss. Also, ear is the organ for balance as well as with hearing. So if the patient has continuous uncoordinated movement, uncoordinated gait, that also may be a sign of nerve damage. Complications can be complete deafness, nerve damage, infection, blood clot in the ear after surgery. Even after surgery, minor or major, this can be a minor surgery actually. So if there is blood clot in the ear after surgery, that can create further infection. That might be one of the complications. Thank you so much. Next topic will be discussed in next video.